There is a shocker for the people of Karnataka as 54 new COVID-19 cases has been reported in the state in the last 12 hours. So this is the big news coming in where 54 new COVID-19 cases has been reported from Karnataka in the last 12 hours. 22 new COVID-19 cases has been reported from MANDYA. 10 new COVID-19 cases reported from Kalaburagi, 6 new cases from HASSAN, 4 new cases reported from DHARWad, 3 new COVID-19 cases reported from Kolar and Yadgiri, 2 new COVID-19 cases reported from Shivamogga. Now, one person has also died due to COVID-19 in Udupi. Total number of COVID-19 cases in Karnataka stands at 1,146. So this is the big news that is coming in, and as one person has passed away, the total number of deaths in Karnataka stands at 37. The active cases are 611 and total discharges stands at 497. So this is the big news where 54 new cases have been reported, taking the total tally of Karnataka to 1,146. Now going ahead for more on this, I'm also joined in by my colleague Suraj Suresh. So Suraj, we are looking at the rural Karnataka which is being affected more, and also Bengaluru rural, especially when you are looking at the regions of Mandya, Ramnagar as well as Biddi, and looking at Mandya in a single day, Mandya has reported 22 new positive cases. What more do you have?
Well, absolutely, Prajwal. One important factor for the increase in the number of cases could be the interstate travel as well, or the inter-district travel. Because once they start allowing the inter-district travel and the interstate travel, that is where most number of cases are arising, because in Mandya there are several migrant workers who have gone to Mandya at this point in time, even Kalaburagi for that matter. People have come from Maharashtra to Kalaburagi, people have come from Maharashtra to Mandya district as well. So the travel history, if we see, most of them are either from different country, that is in Udupi, Dakshin Kannada. If you see, it will be mostly people or the international or the Indians who were stranded in UAE or Dubai. So they are the ones who are testing positive. If you see the ones in Mandya as well as Kalaburagi, they have travel history to Maharashtra or Mumbai. So all of them had traveled from there, and probably they have contracted the virus, because Maharashtra has reported, the maximum number of cases, over 26,000 cases have been reported just from Maharashtra itself, and even the other states across India, that is even Delhi. People who are coming from Delhi as well. If we see, you were speaking about Mandya, Biddi, Ramnagar, these are regions where we are seeing new cases arising, even Kolar for that matter. So these could be the people who have been traveling from Delhi, and then there'll be inter-district travel as well. So this could be a cause of concern. That is why the government is trying to isolate or quarantine them as soon as they reach. But even after that, the spike is only because of the interstate and inter-district travel. One more important factor which has to be seen now is with respect to easing the lockdown. Now the state government will have to take a decision on whether or not they'll have to ease the lockdown in few areas. That needs to be reconsidered. They will have to see, they will have to have a concrete plan as to how they will have to go forward. And probably we are also looking at a spike, because the AIIMS director as well, he had said that India could see a spike in the month of June and July. So we are still in the month of May, the second half of the month of May. So probably we are nearing the spike, and probably we'll be seeing more cases in the coming days, but that will be only proportionate with the number of people who will be coming from different states. That somewhere, if they try to control that crowd, and if they start quarantining and testing that crowd which will be coming from either Delhi or Maharashtra, probably the numbers will rise, but they will be in isolation.
Thank you, Suraj, for joining in with all those updates. So clearly going ahead and taking a look at the number of cases now. Now, rural Karnataka is also inching the same way as Bengaluru, and that is something which should definitely worry the authorities in Karnataka. So what will the state government go ahead and do, and how will they tackle this huge problem that needs to be seen, and only time will have answers to all these questions.